Hey guys, welcome back to EMT Made Easy. In this video I am going over BVM or airway management, however you want to say it, for your NREMT. So the first thing you do for your BVM airway management skill is you want to say BSI. Let the proctor know that you have everything you need for this scenario. The next thing you want to do is you have an apneic patient, so you want to get a response from your patient. So try to wake them up. So, hey, are you okay? Are you okay? The proctor is going to say your patient is unresponsive. At that point, you're going to call for additional resources or call for ALS. And now I'm going to check for a pulse on the carotid, so right here. And I'm going to listen for breathing. And it's good to count out loud and let the proctor know that you're doing it. So tell the proctor, I am checking for a pulse and I'm checking for breathing. And then start counting. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. Eventually between 5 1,000 and 10 1,000 or 5 and 10 seconds, the proctor is going to tell you that your patient has a pulse of 60, but they're apneic. Apneic means that the patient's not breathing. At that point, you know that you have to ventilate your patient. But before you do that, you want to check the airway, to see if there's any vomitus or secretions. So tell the proctor, I'm going to do a head, tail, chin lift, and ask them, what do I have? The proctor will say you have vomitus and secretion. At that point, you are going to put together your suction catheter, or if it's already together, just turn it on. So I'm going to leave it off just for the video so I can explain better. And there's a hole right here behind the yonker or yanker, depends on where you're from, you call it differently. And if you push on this hole, it will suck from this side. If you don't put your hand or your finger on that hole, it will not suck from this side. So you want to show the proctor that you know about this and that you know how to actually use the suction catheter. So you want to put your finger on here and say, I'm checking for suction. I have suction, no suction. And then I'm going to go in as far as I can see for no more than 10 seconds. And I'm going to count backwards in a circular motion. 10, 9, keep going, count to 10 or count from 10 to 1, however you do it. And if at 10 seconds the proctor says nothing, go ahead and take it out, look at them. If they still say nothing, that's your cue to keep going with suctioning. So I'm going back in without suctioning in a circular motion for no more than 10 seconds. Eventually the proctor will say that the mouth and the oropharynx are clear. So now you can get your OPA, and you want to measure your OPA. There's two ways of measuring an OPA for your patient. One is from the tip of the lips, or the tip of the mouth, with the anatomy of the airway and the angle of the jaw. So from the tip to the angle of the jaw. The other way is upside down against the anatomy of the airway, and it's from the corner of the mouth to the earlobe. So this one fits my patient. I'm going to insert it at a 90-degree angle. And ask the proctor, does my patient accept the airway adjunct? The proctor will say, yes, your patient does accept the airway adjunct and there is no gag reflex present. After that, go ahead and get your BVM. Using an EC technique, you're going to put that right here on this side with the apex pointing towards you. And you want to get at the head of the patient. Using your EC technique, the C goes on the mask, the E you use to grip on the jaw. And do a head, tail, chin lift and ventilate for your patient once every 6 seconds. So breathe. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. Breathe. These are inflating, but they're kind of stuck together. So you're going to keep breathing for your patients every 5 or 6 seconds. I do it on the 6th one. Eventually the proctor will say that you are performing ventilations adequately. That's your cue to go back and check for a pulse for no more than 10 seconds. If you go up to 10 seconds and the proctor says nothing, ask the proctor, do I still have a pulse? They'll say yes. And then you go back to ventilations. Don't forget to put O2, you have to put O2 on your BVM or else it's a critical fail. So I'm going to hook up my O2 to my BVM at 15 liters per minute. I'm going to ventilate my patient every 6 seconds. Breathe. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. Breathe. Eventually, the proctor is going to ask you, how do you know if you are performing adequate ventilations. Just tell them bilateral rise and fall of the chest, and that's it. That's the entire skill. If you have any comments, go ahead and leave a message below. Don't forget to subscribe. See you.